Imagine this. A horse looks fine 1 minute, and then suddenly you notice this really strange, almost chocolate brown color in its gums. Even his blood looks brown.
Yeah, it's pretty dramatic when you see it. Sounds like something from a medical drama.
Exactly.
Yeah.
But it's a real condition, often critical. Welcome to the Deep Dive. We unpack complex stuff, try to make it clear, make it engaging.
And today, we're diving into, well, it's a mouthful, equine methemoglobinemia.
Right. Our goal is to look at the source material research, vet insights, and really give you a solid handle on this condition. Super relevant if you're around horses, or honestly just curious about how biology can get thrown off track.
And fundamentally, this deep dive is about hemoglobin, that key protein carrying oxygen in the blood, and how a specific change stops it working.
Okay.
What's really interesting, and you see this in the sources, is horses seem particularly vulnerable compared to other animals. Their red blood cells just don't have the same level of protection against oxidative stress, the kind of stress that causes this.
That really hooks you in. So this chocolate brown color,
Mm-hmm.
how does that actually happen? Like on a basic level, what is methemoglobinemia?
Okay, so simply put, inside hemoglobin, you've got iron. Normally, it's in what's called the ferrous state, Fe plus Biu. That's the form that grabs oxygen.
Right.
Methemoglobinemia happens when that iron gets oxidized. It changes to the meric state, F3 plus B. And that altered form, that's methemoglobin or methep,
And Fe3 plus Bi, it just can't carry oxygen.
exactly, can't bind it, can't transport it. So even if the horse has lots of red blood cells, the oxygen isn't getting delivered to the tissues. You get hypoxia, oxygen starvation.
So it's like the delivery trucks are all there,
Yeah.
but they can't pick up the packages.
That's a great analogy, yeah.
Yeah.
Now, interestingly, a tiny bit of methemoglobin is always being formed naturally. It's normal.
Okay.
But the horse has these protective enzyme systems. NADH-dependent methemoglobin reductase is a key one that usually just change it right back to functional hemoglobin. Keep it in check.
So the problem arises
When those systems get overwhelmed, something causes so much oxidation that the enzymes can't keep up, and the MET-happy levels shoot way up from the normal, like, tiny percentage.
Okay, so when that balance is tipped, what does that actually mean for the horse? What are the knock-on effects?
Oh, it's huge. It really shows you how vital oxygen transport is for, well, everything. When the blood can't carry enough oxygen, you get this cascade. The body tries to compensate, of course. So you see effects immediately in the blood system itself, the cardiovascular system, the respiratory system.
Yeah.
The horse is gasping for air.
Trying to make up for the lack of delivery?
Precisely. But it doesn't stop there. Kidneys, liver, the gut, the nervous system, even things like laminitis, that awful hoof condition, can be triggered. It becomes a whole body crisis.
Wow.
And yeah, if it's severe or not treated fast enough, it can absolutely be fatal.
That's incredibly serious. So the big question then, what triggers this?
Yeah.
What causes such a profound change? Is it usually something they're born with?
Very rarely genetic. Almost always it's acquired, meaning the horse is exposed to something, an oxidizing agent in its environment.
Okay, like what?
The absolute classic, the one everyone learns about, is plant toxicity, specifically red maple, Acer rubrum.
The tree?
Yep. The wilted or dried leaves, sometimes even the bark, contain these toxins. Gallic acid, tannic acid, pyrogallol are suspected culprits that directly hammer the red blood cells, cause massive oxidative damage.
Just from eating leaves.
Wilted or dried ones, usually after a storm or in the fall.
Right.
It leads to severe methemoglobinemia, but also often breaks down the red blood cells directly. That's hemolytic anemia. It's a double whammy.
And the outcome?
It's grim. The mortality rate for severe red maple toxicity is often quoted around 60%. 60%. It's incredibly dangerous.
60%. Wow. That's staggering for a common tree.
Mm-hmm.
Are other plants risky too?
Yes. While red maple is the big one, other maples like sugar maple, silver maple might also contain similar problematic compounds. And some newer research points to pistacia species, pistachio trees and related plants. Their seeds and leaves, like from Pistacia atlantica, shows you need to be aware of landscaping too.
Huh. Never would have thought of that.
And then, maybe surprisingly, onions and garlic. Allium species. We
Yeah.
think of that more with dogs and cats, right?
Yeah.
But if a horse eats a large amount, it can cause oxidative damage, Heinz body formation, these little clumps of damaged hemoglobin and hemolytic anemia, often with methemoglobinemia alongside it.
Goodness. Even kitchen staples. So quite a few plant risks.
Definitely. Those are the main ones we see documented clinically.
Okay, so beyond plants, are there other common ways a horse might get exposed to these oxidants?
Absolutely. Chemicals and drugs are the next big category. Nitrates and nitrites are a major one.
How would a horse get those?
Contaminated feed or water, maybe runoff from fertilizers gets into the water source. Or certain types of forage crops under stress conditions like drought can accumulate high levels of nitrates. And the key thing here is the horse ingests nitrates, but in the gut, bacteria convert them to nitrites. And the nitrites are the real culprits. They're very potent oxidizing agents.
So it's a conversion process inside the horse again.
Exactly. Then you have some pharmaceuticals. It's rare, but certain tranquilizers, like acetaminophen, if given at really high doses, could potentially cause issues. Things like topical benzocaine, that's more a human or small animal worry, acetaminophen, paracetamol, again, more of a cat toxicity issue usually, but high doses aren't good for any species red cells. Basically, anything that puts oxidative stress on those cells is a potential risk.
Fascinating. So many potential triggers. You said it's almost always acquired.
Okay.
What about that rare genetic possibility?
Yeah, very occasionally you can have genetic or congenital deficiencies. This is an inherited problem where the horse is born without enough of those protective enzymes we talked about, the ones that convert Met-Hab back to normal hemoglobin.
So their baseline defense is weak.
Right. Like a deficiency in cytochrome by 5 reductase, it can lead to chronic sort of low-level methemoglobinemia, or episodes that keep happening. There's actually a report of familial methemoglobinemia in a couple of trotter mares. So it happens, but it's definitely not the common scenario.
Okay, good to know it exists, though. So let's switch to recognition. If you're out there with a horse, how do you spot this?
Right.
What are the telltale signs that this oxygen crisis is happening?
It really comes down to spotting the signs of that oxygen deprivation, and how bad the signs are links directly to how high the Met-Hab percentage is. Usually you start seeing obvious problems around 30–40% Met-Hab.
And what's the number one sign?
The absolute classic, the hallmark, is that chocolate brown or muddy color of the mucous membranes. You lift the lip, look at the gums, check the inside of the eyelids, the vulva in mares. Instead of pink, they look brownish or sort of a dirty blue-brown.
Muddy, you said.
Yeah, muddy is a good description. And here's the crucial bit. Unlike cyanosis from, say, heart or lung failure, this brownish color doesn't get better if you give the horse oxygen.
That's a huge clue right there. Differentiates it.
Absolutely critical diagnostic clue. Then you'll see respiratory distress, breathing fast tachypnea, breathing hard, flared nostrils dyspnea. The horse is fighting for air.
Makes sense.
Cardiovascular signs, too. Fast heart rate tachycardia, weakness, lethargy. They might stumble, seem unsteady, or in really bad cases, they just collapse, they go down.
And you mentioned hemolysis, the red cell breakdown is common. What signs does that add?
Right, especially with things like red maple. If hemolysis is happening alongside the methemoglobinemia, you get urine discoloration. The urine turns red or even dark brown like coffee. That's hemoglobin spilling out.
Okay.
You might also see jaundice or icterus, a yellow tinge to the gums or whites of the eyes, from the bilirubin released when red cells break down. And under the microscope, on a blood smear, vets will often see Heinz bodies, little dots of damaged hemoglobin inside the red cells.
Wow, a lot of signs stacking up potentially.
Yeah, and then general stuff too, like the horse goes off its feed, looks depressed, might show signs of colic. And like we mentioned, laminitis is a really serious potential complication, especially with red maple.
So a vet sees some of these signs, especially those muddy gums. How do they confirm it? What are the steps to get a definitive diagnosis?
It's putting pieces together. First, those clinical signs, especially the mucous membrane color, combined with any history like, oh yeah, the storm blew down a maple branch yesterday, that makes you highly suspicious.
History is key.
Always. Then, the blood itself. If you draw a sample, it looks dark brown, chocolatey.
Yeah.
And if you leave it exposed to air, unlike normal dark venous blood, which turns redder, this stuff stays brown.
Another visual clue.
Yep. There's even a quick field test, the methemoglobin spot test. Put a drop of the horse's blood on white filter paper next to a drop of normal blood. If the patient's blood looks noticeably browner after a minute, it suggests Met-Hab is probably over 10%.
A useful first check.
Exactly. But the gold standard, the definitive test in the clinic, is co-oximetry.
Co-oximetry? Okay.
It's a special type of blood gas analyzer that actually measures the different types of hemoglobin directly, normal hemoglobin, carboxyhemoglobin, and importantly, methemoglobin. It gives you a percentage.
And what level is considered significant?
Clinically significant signs usually appear when it's above 10–15%, and certainly by 20–30%. You need to run that test fast, though, because the med high level can start to drop in the blood tube after collection.
Good point. What else would the vet look at?
They'll do a blood smear examination looking for those Heinz bodies and other signs of red cell damage like eccentrocytes. A complete blood count, or CBC, checks for anemia. Is it getting worse? Are there signs the body is trying to make new red cells?
Right.
Serum biochemistry looks at liver enzymes, kidney function markers, and bilirubin levels, which would be high if there's hemolysis. And a urine analysis confirms if there's hemoglobin or bilirubin in the urine or signs of kidney stress.
And tying it all back to the cause.
Absolutely. A thorough investigation of the environment, the pasture, the feed, the water source is crucial to identify the offending toxin. It's detective work.
Okay, so you got the diagnosis. This horse is in crisis. What happens next? Treatment sounds like it needs to be fast and aggressive.
It's an absolute emergency. Time is critical. The main goals are get rid of the source, help the horse get oxygen, and maybe use specific antidotes.
First step.
Get the horse away from the source immediately. If it's plants in the pasture, move them out. If it's contaminated feed, stop feeding it. Sounds obvious, but it's number one.
Makes sense.
Oxygen therapy. Put a tube in the nostril, run oxygen. It won't fix the methemoglobin itself, remember, because that meth can't carry oxygen anyway, but it helps saturate every last bit of the functional hemoglobin that's still working. Maximize what you've got left.
Okay, making the remaining workers work harder. What about fluids?
Essential. Intravenous fluids, often large volumes of balanced electrolytes. This supports the blood pressure, helps hydration, and crucially, helps flush the kidneys, especially if there's hemoglobinuria, trying to prevent kidney damage from all that pigment.
Right, protecting the kidneys.
Yeah.
Now, the antidotes. You mentioned methylene blue.
Yes. Methylene blue is the classic antidote described. Its mechanism is pretty cool. It basically helps the body's own enzyme systems reduce that ferric iron, F3 plus, back to the functional ferrous state, FF2 plus go. So it converts meth back to normal hemoglobin.
So it directly reverses the problem.
In theory, yes. It's usually given as a slow IV injection.
It sounds like a game changer.
Oh, yeah.
But you mentioned some controversy or changing views.
Exactly. This is where veterinary medicine gets interesting and, evolves. Some sources praise it as very effective, rapid acting, but other, perhaps more recent or cautious sources expressed concern.
Concern like what?
That it might actually be ineffective in horses, or worse, could potentially worsen the hemolytic anemia, the red cell breakdown, especially if Heinz bodies are present. Some reports even associate its use with decreased survival rates in certain cases, like red maple toxicity.
Wow, that's a major contradiction. So what's the takeaway for vets?
It means they have to weigh the potential benefits against the risks very carefully, consider the specific case, the suspected cause, and the latest evidence. It's not necessarily an automatic go-to anymore, especially in cases with significant hemolysis. There are also some cautions, like avoiding it in horses with a rare enzyme deficiency called G6PD deficiency, and letting owners know it can turn the urine blue temporarily.
That's fascinating. A real example of science and progress. So if methylene blue is questionable, are there other options?
Yes. Ascorbic acid, which is just vitamin C, it's a powerful antioxidant and can also help reduce meth back to hemoglobin.
Okay.
But it works much more slowly than methylene blue is supposed to. It's often used more as supportive care, or maybe in milder cases. And again, some sources question how truly proven its effectiveness is specifically for this in horses. So, helpful maybe, but not a magic bullet.
Right. What about when things are really bad? Severe anemia, the horse is crashing.
Then you reach for a blood transfusion. If the horse's red cell count, the PCV, or packed cell volume, drops critically low, say below 15% or 12%, or they're just not responding, have persistent high heart and breathing rates despite oxygen and fluids, then giving whole blood from a compatible donor can be life-saving. It directly provides functional red blood cells that can carry oxygen.
A critical intervention in severe cases.
Definitely.
And what about just general supportive care while all this is going on?
Absolutely crucial. Things like pain relief, usually with NSAIDs like flunixin and especially important if laminitis is developing or suspected. Gastroprotectants like omeprazole might be used to protect the stomach lining during stress.
Makes sense.
And close monitoring is non-negotiable. Watching their breathing, heart rate, gum color, urine output, checking blood values like PCV and Met-Hep-B levels frequently. Plus, if laminitis is a risk, aggressive preventative measures like icing the feet, cryotherapy, and providing soft bedding or sole support.
So intensive care, really.
Very much so. And keeping the horse quiet, minimizing stress, no exercise, obviously, offering palatable food and water, and talking to the owner about how to prevent it happening again.
That prevention piece is key. Looking at the overall picture then, what's the prognosis? If a horse gets diagnosed, what are its chances?
It really varies. It depends heavily on what caused it, how much toxin they were exposed to, how quickly it was diagnosed, and how aggressively they were treated. So it's often described as guarded.
Guarded, meaning uncertain.
Exactly. For severe red maple toxicity, for example, the prognosis remains guarded to poor. Even with intensive care, that 60% mortality figure hangs over you. But for milder cases, or maybe toxicity from nitrates where there isn't as much direct red cell destruction, if caught early and treated well, the horse might have a much better chance of recovery.
So early detection and action are paramount.
Absolutely. And again, prevention is so much better than cure. Just knowing the risks, identifying and removing red maples from pastures, checking water sources, being careful with feeds, that's the best strategy.
And if treatment doesn't work or isn't started in time, what are the ultimate worst outcomes?
Well, the complications we touched on can become overwhelming. Severe colic, ongoing diarrhea, debilitating laminitis. If there's massive hemolysis, the kidneys can fail from being overloaded with pigment, that's pigment nephropathy, leading to acute kidney failure. And if the Met-AB level climbs too high, usually above 80% or so, the brain just doesn't get enough oxygen, leading to seizures, coma, and ultimately death. It's a very rapid decline at that point.
A really stark reminder of how delicate that oxygen balance is, this whole deep dive. It really underscores how seemingly common things like a tree leaf can have such a critical, devastating impact, and the absolute need for quick recognition and intervention.
It really does. And what's fascinating from a biological standpoint, isn't it? How this one little change at the molecular level, iron, changing from F2 plus to F3 plus in hemoglobin, ripples outwards to cause such massive body-wide problems. It really makes you think, doesn't it? How vigilant are we really about the things our animals might encounter in their everyday environment?
That's a powerful point. This deep dive, I think, really highlights how knowledge empowers us to protect the animals we care for. Maybe next time you're walking past a red maple or checking your horse's gums, you'll see things a little differently. With a new awareness of these hidden dangers, but also, maybe, the incredible resilience life has when things go wrong.